We are familiar with the concept "it takes two to tango," which describes situations where aligned interaction between two individuals is required to produce a specific result. Even in healthcare during the patient-provider interaction, the two to tango concept also applies, as both parties contribute to the desired outcome. When we visualize a tango, and the intricacy that only precise collaboration can produce, it's possible to draw parallels to the patient-provider relationship, where not just individual contributions, but true partnership is required for successful outcomes. Without both dancers performing in unison, there is no tango. A provider and patient come together with the shared purpose of a successful outcome, whether it's curing a disease, alleviating symptoms, or improving quality of life. Both bring different skills, perspectives, and expertise to the clinical encounter. Providers bring the art and science of medicine to the relationship, and patients bring their day-to-day life expertise. Without the active commitment of the patient and provider, successful achievement of a shared goal is difficult to attain. The tango doesn't come easily. Learning a sequence of steps is the basic requirement to perform it, and countless hours of practice over a duration of time are required to perfect it. Similarly, many newly diagnosed patients who may be entering the healthcare system are forced to learn a new language as it relates to their disease state. They must also learn to build a partnership with their provider, learn to tell their story, and share intimate details about their symptoms, personal history, and deepest fears, all of which can be uncomfortable. In addition, although patient-provider communication may be taught in medical school, residency, or through CME activities, it's not a skill that providers can instantly perfect. Practice and real-world experience is needed. Building and maintaining a partnership between a provider and patient constitutes a dramatic change in power, responsibility, and method of interaction. A successful partnership requires both patient and provider to listen, learn from one another, step outside their comfort zone, and be committed to building a relationship over time. Even though basic steps define the tango, each performer introduces varying skills and style of interpretation. The tango dance incorporates countless steps and poses. Similarly, patients are unique in the areas of life experience, preferences, family history, comorbidities, barriers, and literacy and engagement levels. Providers bring to the table varying backgrounds, skill sets, and approaches. Recognizing that there are variations in style and skill, each partner must give and take during the performance, combining knowledge of the dance with knowledge of their partner. With such wide possibility for variation, alignment, cueing, and subtle but specific communication between performers are the elements that combine for a precise execution. Similarly, flexibility and sensitivity are required in the provider-patient relationship. A shared commitment to communication is the foundation of a successful partnership. Patients need to learn to tell their story. Providers may need to teach them to do this, and they must be able to listen and respond to the wide-ranging and varying stories they will undoubtedly hear. Now established, this relationship allows for shared knowledge and experiences, shared decisions, and a successful outcome.